based on singeing, blackening, and tattooing. Okay. So first one, what's the distance? Blackening just only on the margin. So this is tight contact. And here you can see two circles. The outer one is due to the muzzle imprint. So this is muzzle imprint. Outer one is due to muzzle imprint of the firearm. So this is also tight contact. In this one, you can see prominent blackening. This is close contact. Only tattooing. So this is intermediate. And this is distant range. Nothing is present. Only abrasion color you can see. Only abrasion color. Now, distance based on size, shape and size, as I told you, it will basically help in smooth bore. In rifle arm, it will not be much useful. In perpendicular, if the rifle arm, because no matter whatever is the distance, if the bullet is going perpendicular, then the shape of the wound is round. If going oblique, then it is oval. So the distance does not matter much. In smooth bore, initially the pellets go together and then they start separating out. So up to 30 centimeter, it's a round wound. And then the pellets slightly start separating out. This is called rat hole wound. And then what happens is, suppose there are 100 pellets, maybe 98, 95 will remain together and few will separate out. So these few separate wounds are called satellite wounds. After 4 meter, there are only individual pellet wounds. Only individual pellet wound. Okay. Then this is a special type of wound, contact or close contact overhead, because the gases do not get enough space to expand inside the head. So it puts an outward pressure. So what can happen is large, and this is true for both rifled as well as smooth bore. This is an exception. This is a special scenario, exception scenario, which leads to large cruciate shaped or stellate shaped wounds. Stellate means star shaped like this. Or sometimes if the amount of gases is too high, the complete bursting of skull can occur. Complete bursting of skull can occur. Here, this is a special scenario where the entry wound resembles exit wound. Okay. So here what is going to happen is sometimes the wound can be, there can be muzzle imprint like this. Muzzle imprint can occur like this. Sometimes what is going to happen is that there will be a, on head, on skull, there will be a wound like this, or with some blackening or bursting of skull. And sometimes it can also occur in close contact, but in close contact, the amount of blackening will be more. And then bursting can occur. Bursting can occur. Okay. So basically the entry wound is small, shape is regular, round like this. Here it is irregular like this. Edges here are inverted. Here it is inverted. But the exception, this is the exception I told you. This is the exception where the entry wound resembles exit wound. Okay. The burning, blackening, tattooing, these are all the features of entry wound, not the exit wound, except abrasion collar, which can sometimes be present in exit wound also. Beveling of skull, in entry wound, it is on inner side. In exit wound, it is on outer side. Okay. Inner entry, exit, outer. Types of bullet. So first one is the expanding bullet, which expands on hitting the target. So this is also called mushroom bullet or dum-dum bullet. It's of two types. One is which has a pit in front of bullet, and other is where the front is uncovered. The first one is called hollow point bullet. The other one is called soft point bullet. Okay. So when the bullet which fragments on hitting the target, fragile bullet, frangible bullet. It produces fire, incendiary bullet, because it has phosphorus, which burns brightly like this. This is tracer bullet. Bullet deflects on striking, that is ricochet bullet. Two bullets coming out together due to faulty firearm. So first one doesn't come out initially, and then the second one is fired, it comes out. So due to faulty firearm, two are coming out. That is called piggyback bullet or tandem bullet. Another one is, you can see in the cartridge itself, it is designed in such a way that two bullets are kept. Okay, this is duplex cartridge or tandem cartridge. So cartridge word is here. Above there is a word of bullet, below there is a word of cartridge. Okay. So it is by design. This is by some imperfections above one. Bullet which remains in body for a long time, that is called souvenir bullet. Okay. This can lead to lead poisoning. Lead poisoning. When the bullet moves irregularly, that is called tumbling bullet. Sorry. Irregularly is yawning bullet. We yawn irregularly. Anytime we yawn, and when the bullet moves properly end to end, it rotates. You can see it has rotated end to end. That is called tumbling bullet. Just give me 1 minute. Okay. Then primary and secondary markings on the bullet. Primary markings are class characteristics. Secondary markings are individual or accidental characteristic. Primary markings occur due to manufacturing, design, and these are due to manufacturing imperfections. Okay, the medical legal primary marking will be help us to know the model of the gun, and secondary marking helps us to know the exactly which gun was used. So secondary markings are more important because they are individual to a particular firearm. Okay. Test to detect gunshot residue. Remember the mnemonic HANDS. These are used to detect gunshot residues. Please remember, all of them detect heavy metal components of primer. All of basically primer contains heavy metals. Okay, and all of these tests help us to detect the heavy metal components of primer, except dermal nitrate test. Dermal nitrate test detects something else. It doesn't detect heavy metal. Okay. Surgical alteration of fire wounds. That is called Kennedy phenomena. So then surgeon alters the firearm so then it becomes difficult to assess. Okay. Normal body temperature 37 degree Celsius or 98.6 degree Fahrenheit. Hypothermia is below 35 degrees Celsius, or you can say below 95 degree Fahrenheit. Severe hypothermia is below 32 degrees Celsius. Death occurs below 28 degrees Celsius. Trench foot occurs between 5 to 8 degrees Celsius. Frostbite occurs below minus 2.5 degrees Celsius. Minimum environmental temperature to produce burn is 44 degrees Celsius. Heat stiffening occurs above 65 degrees Celsius, and scalds occur due to hot liquids above 60 degrees Celsius. Now, hypothermia death. There are four features. This photograph you can see, it shows two features. One is paradoxical undressing and terminal burrowing. Hyde and die syndrome. Color is bright red. And then this is frost arrhythmia. Frost arrhythmia. Okay. Chilblain occurs due to mild cold. Trench foot occurs between 5 to 8 degrees Celsius. Frostbite minus 2.5 degree Celsius. Okay, wetness is required in trench foot. The feet has to be in the cold water. Cold water. Wetness is a mandatory part of trench foot. Affected parts, neft, nose, ear, finger, toes. Here also neft. And trench foot, as the name suggests, it basically occurs in foot. Ice crystals in tissues are present in frostbite. Treatment of frostbite is gradual rewarming in warm water. 37 degrees Celsius to 39 degrees Celsius. Okay. Now, generalized effects of heat, there are four criteria. Heat cramps, which leads to heat syncope, which leads to heat exhaustion. And finally is the life-threatening stage, that is heat stroke. In heat cramps, there is basically leg cramps plus sweating plus pupil size increase. In heat syncopes, there is all the above findings are there, plus decrease in BP, plus fainting. In heat exhaustion, there is above finding plus some increase in body temperature. But heat stroke is very different. It's life threatening. There is failure of thermoregulatory mechanism, which leads to very high body temperature, more than 40 degrees Celsius, or you can say more than 104 degree Fahrenheit. There is absence of sweating. The pupil size decrease in size. Okay. And there is a mental neurological dysfunction. Neurological dysfunction. Localized effects. Dry heat occurs due to hot metals or fire. Moist heat occurs due to hot liquids more than 60 degrees Celsius or steam. This is also called scald burns. Chemical burns occur due to corrosives. Depth. The chemical burns are most deep burns. Moist heats are usually superficial. Dry heat can be either deep, some burns are deep, some are superficial. Vesicles are present in dry heat. Maximum vesicles are present in moist heat, but vesicles are absent in chemical burns because the vesicles are present in dermoepidermal layer, which is completely destroyed in chemical burns. Red line is the zone of inflammation. It is present in dry heat and moist heat, but absent in chemical burns. Again, for the same reason that the skin is completely destroyed. Singeing, burning of hair is of course seen in dry heat. Now, burn surface area, it is extremely important topic that you should study in surgery. Okay, that I will not touch upon. Now, EDH due to heat. So first one is EDH due to heat hematoma. Other one is traumatic EDH. The EDH due to heat hematoma occurs due to because heat causes rupture of bridging veins. Traumatic EDH occurs due to rupture of middle meningeal artery. And this first one will be bilateral because heat has effect everywhere. Traumatic EDH will be unilateral because limited by sutures. So it crosses, it does not crosses. Because of the heat, air bubbles will be there, which will lead to honeycomb appearance. This will be smooth. Okay. This, because of the heat, this is friable. This is jelly-like. This brain is intact in heat hematoma, but in traumatic EDH, something will hit and brain will get injured. CUHV will be it's increase in heat hematoma, normal in traumatic EDH, normal, common sense. Rupture of skin due to excessive heat. This is called heat rupture. How to differentiate from lacerated wound? That in heat rupture, the blood vessels and nerves are intact because there is no mechanical force. So the blood vessels and the nerves are intact. COHB is carboxyhemoglobin. No, because in the burns, carbon monoxide will be produced, so carboxyhemoglobin will increase. Antemortem burns versus postmortem burns. The soot is present in antemortem burns. It is increased in antemortem burns. Line of redness in antemortem. Basically, all the same principles that in any antemortem injury, whether it is antemortem burn, antemortem abrasion, antemortem lacerated wound, any injury which is antemortem, it will have an inflammatory reaction. Okay, so vital reaction, inflammation. Line of redness is also inflammation only. And then because antemortem, there is an antemortem phenomena, there will be proteins will be inflammatory exudate will be there. No? The proteins, electrolytes, all these things will be coming. Post-mortem burns, these things are not there, so there will be only thin, clear fluids. Thin, clear fluids. Anything which is antemortem is always reddish. Anything which is post-mortem is always yellow, dry, and hard. Whether it is burn injury or lacerated wound or incised wound, anything which is post-mortem will be yellow, dry, and hard. Sir, if heat EDH crosses the suture, how can we identify on CT scan? Sir, CT scan is not my purview. Sorry that you ask Madam, Zainab Madam. Okay. We get the dead bodies. We don't need CT scan. Electrical burns. Electrical burn is converted inside the body in endogenous burn and outside the body in exogenous burn. In endogenous burn, there is a contact with electric source. In exogenous burn, there is a gap. Okay. So in endogenous burn, the endogenous burn, when there is a contact, then that is called, when there is a contact, that is called Joule burn. Yes, but autopsy can be done. That I agree. Joule burn. That is electric contact burn. Exogenous burn is of two types: low voltage, when there is a low voltage, and high voltage. The low voltage burn is called spark burn or flash burn. High voltage burn is called crocodile burn. Okay. So this is Joule burn. Joule burn has three layers. The inner one is the shallow crater, which is usually pale, but if it's too much of heat, it can become black, like in this photograph. Then outside this, there is a pale raised skin. And then very much outside this, in the third one, is a zone of hyperemia. This is a very, very small zone. Mostly the Joule burn is a pale burn. Mostly it's a pale burn. This is a flash burn, and this is a crocodile burn. Lightning injury, arborescent marking, they appear like branches. They appear like branches of tree, that is fern like pattern. This, the cause is because of staining of superficial vessels by hemoglobin. Okay, the upper capillaries and all superficial capillaries, hemolysis occurs over there due to the lightning current. And because of that hemolysis, the superficial vessels, superficial capillaries, etc., they get stained by the hemoglobin. So lightning injuries do not follow the path of large vessels. Marbling follows the path of large vessels. Okay, it is just in the superficial capillaries. Time of appearance, it occurs almost immediately. They can immediately to 1 hour after injury, and they disappear in, if in living, if the person is alive, they will disappear in 48 hours. If the person is dead, they don't disappear. These are not burns, as I told you, though we call them burns. These are not burns. These are simply the staining of superficial vessels. It follows the path none. It does not follow the path of artery or veins. Sexual offenses. Natural, there is a sexual intercourse. Unnatural, there is a sexual intercourse. In sexual perversion, there is no sexual intercourse. Why not? Because if the death has occurred, if death has occurred, the person will, the body will not do any cleaning. No, why will body do any mechanism to clean it? After once death has occurred, the body will remain in that same position. No changes will occur. Any changes occur before death. These are inflammatory things. No. Birth of the child occurs in natural, but not in other two. Okay. The examples of classification natural sexual offenses are rape, sex with closely blood relation. This is called incest. It is an offense with consent? No, it is not an offense in India. Sex with wife of another man. This is called adultery. This is not an offense again in India. Earlier it was an offense, now it is not an offense. These four are unnatural sexual offenses. Okay. Definition of rape is insertion of woman into her vagina, urethra, anus, and mouth. Okay. Earlier it was you insert you apply mouth, insert any object or any body part to these things, or of course penis, or any of these things. If you do, that will be called rape. And in mouth, if you insert penis, that will be called rape. Okay. Unnatural sexual offenses with consent, unnatural sex with consent is not an offense. Okay, it is an offense only without consent. Okay. Forceful sex of wife by husband is not rape as per Indian law. It's not rape. Okay. Though, of course, if there is a cruelty, the woman can file in other sections like mental cruelty, physical cruelty, but it will not be called rape. That doesn't mean that the husband cannot be punished. Of course, husband can be punished, but it will not be called rape. There is no concept of marital rape in India. Whenever the rape victim comes or any person comes, the first step is always to take history. Minimum age at which a girl can give consent for sex is 18 years. Should history be taken from a girl below 12 years? Yes or no? History should be taken from everyone. I'm not talking about consent, but about history. If rape victim refuses to get examined, then informed refusal need to be documented? Yes. Female doctor is mandatory? No. Even the male doctor can do in presence of a female attendant. Treatment to be provided free of cost? Yes. Radiological age confirmation required or no? The documentary only if there is doubt, only if doubtful. Otherwise, the Aadhaar card, PAN card, 10th mark certificate, these are more reliable. History and examination of past sexual behavior. Example, two-finger test to be done. Never. It should never be done because we are concerned with the current rape. We are not concerned with the past history. Should police be informed even if rape victim does not want? Yes, because it's a major offense. Who can be present? Relative can be present. Police should never be present. Can doctor give the opinion if rape has been committed or not? No. Rape is a legal term. This is given by a court. What doctor can tell is that there is a signs of recent violent sex. This is what doctor can tell. Absence of injury on victim rule out sexual assault? No. Many times the injuries don't occur. Per speculum examination must be performed in young girls. See, we have to do the examination in accordance with the history. Okay. In young girls, the penetration is very difficult. So why to unnecessarily trouble them? So answer is no. Evidence collection of the body victim presents late. So one is evidence from the body, other is outside the body. From the body, maximum up to 96 hours, maximum. Because after that, the evidence will wash away. It will disappear. It will not remain. Outside the body, like clothes, anytime. In camera trial means only selected people allowed in court. Allowed in court. Normally, in any case, any public can come, but not in rape case. In rape case, only like accused or the witnesses or the victim and their lawyers, etc. Clothes removal of the victim, it has to be removed by no touch technique. No touch technique. The victim stands on a white cloth, removes her own, and then you have to collect clothes plus the sheet. And each cloth in different bag. Each cloth in different separate bag. Type of bag, it has to be a paper bag. not the plastic bag, because plastic bag will trap the moisture. How to fold? Fold in such a way that the stained part do not touch the unstained parts. Stained, fold in such a way so that the stained part do not touch the unstained part. Okay, last slide. देख लो. So when is the exam? When is the exam? Oh, how many days left? How many days left? So these few days can completely change your rank. The study is done in last 1 to 2 months. Last 1 to 2 months have the maximum impact. If the clothes are wet, then you should dry in air under the shade, not under the sun. If you keep under the sun, it will denature. Just dry in air under the shade. Pubic hair. Combing is used for loose hair. Cutting is used for matted hair. And pulling is used as control, because it will only ensure that the hairs belong to that same person from whom you are collecting. Okay. Hymen which can be confused with tears due to multiple notches. What's the answer? Which hymen can be confused? Fimbriate hymen, also called denticular hymen. Then tear of hymen occurs during the first sex at what position? Between 5 o'clock to 7 o'clock position. Then after childbirth, the hymen is completely destroyed, and this is called carunculae myrtiformis. After childbirth, the hymen is completely destroyed when it is called carunculae myrtiformis. Hymen in false virgin is large or has large opening. It's thick, fleshy. So that's the reason it does not rupture, and elastic. Okay. This is Glacier Keen rod to see the hymen. And then initially the injury not visible, later on it becomes visible. Which dye is used? Which dye is used? Toluidine dye. Smegma is present on glans penis. That means no sex in past 24 hours. Smegma is absent. That means either there is sex in past 24 hours or cleaning of private parts have been done in past 24 hours. So stains used to detect recent micro injuries on genitalia is toluidine dye, as I told you. And to detect vaginal epithelial cells on penis, it is which stain? Lugol's iodine and PAP stain. Okay. Unnatural. So in gerontophilia is sodomy with adult, pederasty is sodomy with child. So the active agent is adult in both the cases. The passive agent is adult in gerontophilia, but child in pederasty. This passive agent, child in pederasty, is called catamide. So C for child, C for catamide. The anal skin of a normal person is like this. In a habitual passive agent, there is a loss of, so donut like, perianal fold. Okay, and the skin becomes thick skin, thick and smooth. Lateral traction test, you retract the buttocks with hands. So what is going to happen in normal person? There will be a reflex anal contraction. In habitual passive, there will be anal dilation. Gerontophilia is, yes, old person. Sex, gerontophilia is sex, sodomy with old person, sodomy with an adult basically, not with a child. Lesbianism is female homosexuality. The active partner or the masculine female is called dyke or butch. The other female is called femme. Oral sex. O, 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 O everywhere. Okay. Oral stimulation of penis is fellatio. Oral stimulation of vagina is cunnilingus. Sex with animals is bestiality. Sexual perversion, sex by sending of pain. So sender of pain is called sadism. Sending of pain is called sadism. Okay, lust murder is extreme form of sadism. Person gets gratification by killing the partner. Opposite of sadism is masochism. War for watching. Watching people is voyeurism. War for watching, war for voyeurism. Also called peeping Tom. Also called scoptophilia. Scoptophilia. Scop means to see. Endoscopy. Colonoscopy. Scope means to see. Rubbing genitals. That is voyeurism. In crowded places. So double T together, that is crowded places. Exposure, E for exposure, E for exhibitionism. Sex by non-living objects, fetishism. Okay. Cross-dressing is transvestism or eonism. It can be of two reasons. One is because of sexual gratification. Other is because of some any other reason. For example, some gender identity disorder. If it is for sexual gratification, then it is called transvestic fetishism. So this kind of transvestism is a sexual perversion. This is not a perversion. If the person is wearing clothes of opposite sex to get sexual gratification, then it is a perversion. But if he's wearing the clothes for some other reason, then it's not a perversion. For example, some gender identity disorder. Eating of dead bodies, necrophagia. Sex with dead bodies, necrophilia. Sex with children, pedophilia. Obscene speech, setologia. SS. Feces, coprophilia. Urine, urophilia. Sexual desire in males, satyriasis. Then in females, nymphomania. Okay. Other term for masturbation is onanism. So O-N-O-N, onanism. Okay. By enema is clismaphilia. Sarvottam is asking. ठीक है. By enema is clismaphilia. ठीक है. Enema, clisma. Manner of death in sexual asphyxia is accident. अरे भैया कोई चीज नहीं बताई है तो ज्यादा इंपॉर्टेंट नहीं होगी, तभी नहीं बताई ना, नहीं तो खुद ही बता देता. इतना कुछ है पढ़ाने को. पढ़ाना वो है ना जो ज्यादा जरूरी है. मुझे क्या है, मैं रात भर बैठ सकता हूं. The purpose is to give you high scoring things. ये क्लास दूसरी तरह की है. It's a high yield class. Sexual asphyxia is निशाना उस फल पे मारना है जिसके गिरने के चांस ज्यादा हैं. मतलब समझ रहे हो? जिस फल के गिरने के चांस कम है उस पर टाइम वेस्ट नहीं करना। जो थोड़ी सी मेहनत से गिर जाए, लो हैंगिंग फ्रूट, अभी वो चाहिए हमको। सेक्सुअल एस्फिक्सिया इज एसोसिएटेड विथ विच सेक्सुअल perversions? It is, so remember the mnemonic: sexual asphyxia में टपकोगे। M for masochism, T for transvestism. Are you guys with me or not? Are you understanding or not? Is it helping you out or not in revision? Abortion. Expulsion of person conception at any time before full term is called abortion. So this is the legal definition. The medical definition may be before 20 weeks, 28 weeks. So legal definition is any time before full term. Killing of fetus at any time before prior to birth is called feticide. So in feticide, we are killing. In abortion, it may not be killing, it may be spontaneous also. Killing of an infant, infanticide. Killing of child by parents, filicide. MTP Act is extremely topic. I think that will be covered in PSM or gynae. Drugs which increase the uterine contraction, these are called ecbolics. And drugs which increase the menstrual flow, emmenagogues. Then the abortion stick. This is a stick. Abortion stick is a stick which has which are soaked in the juice of irritant plants like marking nut, calotropis, and it is put inside the uterus. It is put inside the uterus. That, so what's the mechanism of action? It increases uterine contractions. The drugs which increase, सर्वोत्तम सिंघानी, आप तो ऐसे पूछे थे, फर्स्ट टाइम पढ़ रहे हो। ड्रग्स विच इंक्रीज यूट्राइन कॉन्ट्रैक्शन, दोस ड्रग्स आर कॉल्ड एक्बॉलिक्स। ये तो भैया रिवीजन है, फर्स्ट टाइम क्लास थोड़ी ना है। एंड ड्रग्स विच इंक्रीज मेंस्ट्रुअल फ्लो, दोज आर कॉल्ड immunogogues. And then wooden stick is a stick on which we apply some irritant juice and put inside the uterus, which increases uterine contractions. Now, ability of fetus to lead a separate existence from its mother is called viability. So, for viability, the age or the period of gestation should be more than 28 weeks. Any child with period of gestation more than 28 weeks can live separately. If the child shows any signs of life after being born, that is called live born. The baby dies during the process of delivery after 28. So two things: during the process of delivery plus more than 28 weeks of gestation, that is called stillborn. And when the fetus dies much earlier in the uterus itself, that is called dead born. Okay. Now, age of viability can be determined by three methods. One is from the ossification centers, then from the length of the fetus, and then the overall fetal development. This we have already discussed. Let's discuss from the other two, length of the fetus. So, rule of Hesse. So, the length should be complete length, crown heel length. So, you check if the length is less than 25 centimeter, first rule. More than 25 centimeter, the second rule. The first rule is for the age of the fetus in month is equal to square root of length in centimeters. And the second one, age in month is equal to length in centimeter divided by 5. Okay, just give me 1 minute. Okay. So for the weight, just remember three weights. Second, 2, 4, and 7. 2, 4, 7, 10 gram, 100 gram, and 1000 grams. Okay, 2, 4, 7. End of first one, hardly any feature. 2 months, there are सर 25 आया तो क्या फॉलो करना है? If it is come 25, you follow any rule, the same answer will come. Okay. There are two mouth, two nose and two eyes. अगर कुछ सेपरेट होता तो मैं खुद ही बताता ना बच्चों. अगर मैंने कुछ नहीं बताया तो उसको बताने की जरूरत नहीं थी. सॉरी क्यों बोल रहा है भाई? भूल गया क्या? पहली टाइम क्लास अटेंड कर रहा है. मनुष्यत नहीं चाहिए, सॉरी वॉरी नहीं चाहिए. बिंदास रहो, मस्त रहो, खूब पढ़ो और आगे चलो. ठीक है. देर आर टू nostrils. अब now I will be speaking very softly. Okay, no worries. How many of you are attending my class for the first time? Tell me. So today I am in a different mood. Normally I am in a different mood. I have taken the crash course on soft skill. Like you are having this because earlier the students which are taken my class earlier, they know how I used to speak. So now I have become more of a human being. I have learned soft skills. Okay. What is JG? These people with love called me JG. Jai Gurudev. ठीक है. So I hope you are liking my new avatar. End of 3 months, the nails appear. Then at the end of fourth month, S, L, M. Why change sir? क्योंकि कुछ बच्चे डर जाते थे. क्यों लगता था कोई टीचर आया जो मार पीट के भगा देगा. Sex can be detected. Lanugo hair appear and meconium appears in. और बाकी आराम से पढ़ लो, नहीं तो पुराना रूप में आने में ज्यादा टाइम लगेगा नहीं. Upper meconium appears in upper small intestine. Meconium appears in upper small intestine. Okay. SLM. At the end of 5 months, scalp hair appear. Scalp hair. So how do you remember? Scalp 1, 2, 3, 4, 5. So 5 is 5 months. And here 1 month is equal to 4 weeks. So we will have 10 months. Sir, you know Dr. Jhamad. I know everyone. 5 months. Scalp hair appear. End of 6 months, then what is going to happen is, so first there is scalp hair. After scalp hair, the eyebrows come. After scalp hair, the eyebrows come. अगर अर्लियर वॉज मोर मोटिवेटिंग, शिकारी कुत्ते बन जाते हम ऐड, तो शिकारी कुत्ते तो तुम बन गए थे ना. या बाद में हर बार तुम लपड़ झंडूस बनोगे, फिर तुम्हें दोबारा शिकारी कुत्ता बनाना पड़ेगा? भैया मैं तो ये मानता हूं ना, क्लास हो गई, दैट मींस यू हैव ऑलरेडी बिकम भेड़िया और शिकारी कुत्ता. सो यू बिकम भेड़िया आफ्टर माय क्लास एंड यू अगेन बिकम लपड़ झंडूस. So scalp hair appears and then eyebrows appear. So after eyebrows, and other thing is both the testes appear near kidneys. Near kidneys. So 1, 2, 3, 4, 5, 6. 6 months. Okay. And end of 7 months. This is the age of viability, very important age. So here what happens is, at 6 months testes appear near kidney. At 7 months both testes go near external inguinal ring. At the end of 8th month, one testis in scrotum. At the end of 9 months, both testes in scrotum, both testes in scrotum. तुम लोग गाली खाए बिना मानोगे नहीं, मैं इतना मेरा कोर्स किया, सॉफ्ट स्किल सीखी, फिर तुम at the end of 1 month one test is in scrotum, at the end of 9 months both testes in scrotum. ठीक है? अरे भैया डॉक्टर बन गए, इतनी पढ़ाई कर रहे हो, यू आर ऑलरेडी अ विनर. व्हाई डू यू कंसिडर योरसेल्फ लपट झंडूस? यू आर ऑलरेडी अ शिकारी कुत्ता, यू आर ऑलरेडी अ भेड़िया. समझे? Signs of live birth. One is baby cry is considered a sign of live birth. Normally, baby cries after being born. Normally, normally, baby cries after being born. But rare condition can occur when the baby can cry even before being born, like vegitus vaginalis. Here, the baby cry in vagina. Vagitus uterinus, baby cry in uterus. So these two are not the sign of live born. So normally cry of baby is a sign of live born, but if the baby cries before being born, that's not a sign of live born. This will be studied in PEDS, very important topic. Umbilical cord falls in about 6 to 7 days. Okay. Now what happens is, before respiration, there is a gelatinous substance. It gets replaced by air. The middle ear gets replaced by air. Middle ear, the gelatinous substance gets replaced by air after respiration. This is called Redine's test. Redine's test. Meconium, the baby passes the feces. Meconium becomes absent in large intestine after about 24 to 48 hours of birth. Now, most important changes are seen in lungs. Weight of the lungs increase after respiration because of the increased blood circulation. But specific gravity of the lung, it decreases because air goes inside. So Fodder's test is depends upon, it is basically the weight of the lungs changes from 35 gram to 70 gram, weight of both the lungs combined. Plockett's test is the ratio of weight of lung upon weight of body. It changes from 1 upon 70 to 1 upon 35. Then hydrostatic test or Raygatt's test or Breslau's first life test. So please remember, Breslau's first life test is for lungs and Breslau's second life is for Breslau's second life test is for stomach and intestines. Second life is for stomach and intestines. In the first life test, what is going to happen is that you put the lungs in water, the lungs will float in case the respiration has taken place. Here the lungs will sink. False positive hydrostatic, if the lungs float, that is called hydrostatic test positive. False positive means air is going inside the lungs even if respiration has not taken place. That can occur due to artificial respiration, putrefaction. False negative hydrostatic test can occur due to atelectasis, pneumonia, etc. Okay. Now, signs of dead bone. There are 3 ways by which the dead body decomposes. Sir, false negative hydrostatic. उल्टा कहाँ हुआ है? सही तो है? कौन सा उल्टा हो गया? After respiration, air will go inside and lungs will float. मजे ले रहा है बाबू? First one, signs of dead bone. The most common process of decomposition in dead bone is maceration. also called aseptic autolysis. Earliest sign of maceration is skin slippage. Now, the, the color of the skin, tissues, and fluid in cavities become, tell me, reddish in color. You remember in putrefaction it was greenish. Gas gases are produced which can be seen in the great vessels. This is called Robert sign. It is the earliest radiological sign. It is the earliest radiological sign. Then the overlapping of skull bones occur. This is called Spaldig sign. It occurs in 2 to 5 days. It occurs in 2 to 5 days. Then mostly, usually maceration occurs. Then less commonly, if there is scanty Leaker amni or deficient blood supply, then mummification can occur. And very rarely, if the membranes rupture and bacteria come from outside, then putrefaction can occur. Which process does not occur at all in dead bone? Adipocere. Child abuse is of three types: battered baby syndrome, factitious disorder, and malingering. Battered baby syndrome occurs due to parents' frustration. Baby crying, parents, father does not have proper job, good wife, they beating each other, cut. Okay, frustration. Factitious disorder is because of a mental illness. I mean, either the wife is not good or husband are not good. Either of them is not good and fighting with each other. Okay, so don't consider me sexist. Mental illness, factitious disorder occur due to mental illness. Here the mother wants attention from the doctor. Mother loves doctors. Mother wants attention from the doctor. In malingering, so mother produces illness in the child. Mother produces illness in the child. Malingering is because of some financial motive, like getting the health insurance, etc. Parents in battered baby syndrome, the parents will not go to the doctor early because they will get fearful. They will go to the doctor only late if some complications occur. Here in factitious disorder, early. In malingering, also early. Okay. Battered baby syndrome is also called Caffey's syndrome or Campes syndrome. क्या एलिमनी लगा रखा है? एलिमनी कहाँ से आ गया फोरेंसिक में? अरे भैया, हस्बैंड वाइफ कोई भी पगला हो सकता है, किसी की बुद्धि घूर सकती है, समझे ना? और मर्दों की ज्यादा दिमाग खराब होता है, हो किसी का भी सकता है. Vague, what happens is there is vague history vague history not corresponding with injuries. The bruise will be 7 days old, but the parents will say he felt today only. There will be multiple injuries in different stages of healing because child gets beaten up on Monday, Tuesday, Wednesday, Thursday, Friday. So there can be 6 penny bruises like this because of the gripping. Okay. फेमिनिस्ट और सेक्सिस्ट में क्या डिफरेंस होता है? फेमिनिस्ट, सेक्सिस्ट, भाई ह्यूमन बीइंग है ना सब. आदमी है कि औरत है, मेल है या फीमेल है, वी ऑल आर ह्यूमन बीइंग, वी ऑल हैव सेम प्रॉब्लम्स. जबरदस्ती के वर्ड निकाल रखे हैं. मेल्स को भी वही डिप्रेशन, एंजाइटी, फ्रस्ट्रेशन होती है जो फीमेल्स को होती है. जबरदस्ती का ये नाटक नहीं बना रखे फालतू के. shaken baby syndrome. इस पे मर्द है या औरत है, मतलब ये है कि अपने जीवन में वेदर वेदर यू आर अ मेल और अ फीमेल, द मेन थिंग इज whether you are able to live a fulfilling contented life or not. Bas, that's it. Shaken baby syndrome is a special type of battered baby syndrome. So here the child is held into the arms of the parents and shaken up like this. For example, and this is called infantile whiplash syndrome, also called abusive head trauma. There's a classic triad of subdural hemorrhage, intraocular bleed, and encephalopathy. Encephalopathy. Two kinds of fractures should always raise suspicion of child abuse. One is the rib fracture, other is the fracture of metaphysis of long bones. These should always raise suspicion. Okay, yes, bucket handle fracture. Sudden infant death syndrome. The child is, baby is healthy, sleeping, suddenly dies. Okay, what's the most common manner? Most common manner is natural. And rarely it can be accidental. And very, very rarely it is homicide. Natural, for example, due to sleep apnea. Accidental, for example, due to overlaying of mother on the child. Okay. Superfectation. Both the cases, two babies, twins occur in both superfecundation and superfetation. But what's the difference? Superfecundation, both the cases are two separate acts of sex. But in superfecundation, both the acts of sex have occurred in the same cycle. Here in superfetation, two different cycles. How do you remember? Double T here. So two different cycles, superfetation. So because it is same cycle, so same development. Here it will be different development. Okay. Fake child produced. The baby, so like you would have seen in Indian movies, original child is missing and some other child is produced and told that he is your real child. You give him the property. Okay. That is called fictitious child. Also called supposititious child. Etious. And when the child does not exist at all, imaginary child, that is called fictional child. Child born after the death of parent, posthumous child. Posthumous child. Sir, for the longest time, females did not have equal rights. That's the why we need feminism. So, dear Disha and dear all the students, for me, whether it's a male student or a female student, for me, all of you are dear students. Okay, so I do not differentiate. Rest, I leave all to your fine judgment. All of you are learned beings. For me, you are simply student, not male student or female student. Plus, okay, the main source of energy to brain during starvation is, tell me. So so please remember, superfecundation is extremely rare and superfetation is extremely rare. Understood? Superfecundation is extremely rare, and superfectation is extremely rare. Ketone bodies. Person dies after how many days? After there is no intake of food and tell me, tell me about 10 days if no food and water. If only food is not there, then you can say but water is there but food is not there. Maybe you can say 50 days. 50 days. Okay. Please remember most of the things will shrink. Most of the thing will shrink. Most of the things will shrink, but the gallbladder gets distended because it is filled with bile. Because there is no stimulus, there is no food, so the gallbladder doesn't contract and the bile remains there. In starvation, atrophy is seen in all organs except brain. दिमाग काम करता रहता है, इंसान के माइंड को, ब्रेन को कभी शांति नहीं मिलती. ठीक है. In starvation, last fat to disappear is, tell me. Buccal fat. Buccal fat. Buccal fat. Okay. Impotency, sterility, pregnancy, delivery. Inability to perform sex is impotency. Painful contractions of vagina during sex, vaginismus. Most common cause of erectile dysfunction is psychogenic. Impotency towards a particular woman. Quad Hank. Just a second. Lack of sexual desire in female, cold female, that is frigidity. Inability to reproduce is sterility. Opposite of sterility. So sterility and infertility are similar. So you can say when we especially say not conceiving after 1 year of sex, then specifically we use the word 1 year, then we call it infertility. So sterility for 1 year is infertility, something like that. Which one is the ground for divorce? Impotency. Lochia, Rashi, RSA. R for rubra, S for serosa, A for Lochia alba. Russia. Forensic psychiatry. Mens rea, guilty mind. Actus reus, guilty act. Compos mentis, sound disposing mind. A mind which can understand right versus wrong. Okay. Can a mentally ill person be of sound mind? Yes. If the mental illness is mild, yes, it can be. Can a person without mental illness be of unsound mind? Yes. Example, drunk person or electrolyte imbalance, etc., etc. Now, period of normal behavior in between the periods of abnormality. in between the periods of abnormality. This period of normal behavior is called lucid interval. The cause can be head injury, the EDH, mostly EDH, sometimes SDH, and insanity. During lucid interval, the rights and responsibilities are same as of normal person. Same as of normal person. Ability to make a valid will is called testamentary capacity. Will made by a person in his own handwriting is called holographic will. Very important section. 22 BNS is for criminal responsibility of mentally ill, and it is derived from basically where if the person can't understand what is wrong, then he will not be punished. It is derived from McNaughton rules. Then in India, we use 22 BNS or McNaughton's rule, but there are other rules also. You don't have to undergo details of these rules, but you should be knowing that these are the rules used to determine criminal responsibility of mentally ill. Number one, you don't have to go into details of these. Second thing is, just two definitions are important. Durham's rule definition and Curran's rule. Durham's rules is not responsible if it's a product of mental disease or defect. So D here, D here, D here. No need to go into detail. Just remember this phrase, product of mental disease or defect. Curran's rule, capacity to conform the requirements of law. Remember this phrase. C for Curran, C for capacity, C for conform. Okay. Now, criminal responsibility of person in following contain in hypnosis, it's responsible. Impulse disorder, responsible. Voluntary intoxication, responsible. Involuntary, not responsible. Delusion, it is actually plus minus. It depends upon the type of delusion. But many times in your exam, the details on the type of delusion may not be written. So in that case, you can consider not responsible. Delirium, not responsible. Sleepwalking, not responsible. ठीक है, आंसर मिल गया. Sleepwalking is not responsible. True insanity, it's gradual, it's sudden. Here there is no motive, here there is motive. Sign and symptom true insanity will be by and large uniform. Feigned insanity, very much changing. Feigned means fake. Insomnia, very much present. Here, not present. Ability to withstand extreme exertion, yes, no. True insanity, filthy habits. Here it's normal. In feigned insanity, it will be normal. Toxicology. ठीक है? So here I will not go into classification. I simply tell the last point explain again, sir. Cleanliness. About true insanity, the person is filthy because he is insane. He does not take bath, nothing. He shits in the pants. Fake insanity. Even if you are faking, you will not be able to shit in your pants. Okay. Now, the red ones are the most important. So the class, you don't have to ratify the classification. that is not required. Rectification of classification is not required, but this classification will help you in understanding the concept. You don't have to, as such, rectify the classification. So, red ones are the most important. Okay, so maximum focus in toxicology you should do for the commonly asked poisons. As the toxicology is a vast topic, it will become easy if you focus only on the selected poisons more. Okay. So corrosives, irritants, spinal poisons, peripheral cardiac asphyxiants. The main deliriant poison amongst above is the Datura, cannabis, cocaine. Poisons delaying putrefaction, jackass, zinc, arsenic, carbolic acid, antimony, and strychnine. High anion gap metabolic acidosis. High anion gap metabolic acidosis, mud piles. And there are few poisons which cause high anion gap metabolic acidosis. These are basically, you can see alcohols. Alcohols like ethanol, ethylene glycol, methanol, propylene glycol, different alcohols. Apart from that, paraldehyde, iron, isoniazid, then CO and CN, CO, CN, and salicylates. So there are very few poisons which causes high anion gap metabolic acidosis. Usual color is reddish purple or purplish red, I will say rather, purplish red. Then in C for carbon monoxide, C for cyanide, C for cold. There the color is cherry red in color. So cherry red color is actually same as brick red. It is same as brick red, and it is same as, I will say, uh, bright red, I will say, or bright brick, not bright red, I will say bright red. Cherry red or bright red or bright pink. These are all similar colors. So C, C, and C. Easy to remember. But if your exam, the question comes for cherry red, the first preference is always carbon monoxide. For cherry red, the first preference is always carbon monoxide. Phosphorus or copper, dark brown or yellow. Drug which causes methemoglobinemia. Okay, they cause dark chocolate brown. Dark chocolate brown color. H2S bluish green. ठीक है? Tired? 2 मिनट्स ब्रेक. क्या करोगे 2 मिनट में? चलो 5 मिनट ब्रेक दिया तुमको. खुश? 7 मिनट दिया. 10:48. Let's meet at 10:55. Happy? क्लास कर देंगे यार, 1 घंटे में खत्म कर देंगे. ठीक है. Color of PMS means color of post-mortem staining.